the Public Health Services team, ASEC Rosette Vergere. ASEC Rosette Vergere will now read the updates and present to you what's happening for the COVID-19 health event.
Good afternoon, everybody. For today's updates on the public on the COVID-19 health event, the Department of Health today revealed that as of 12 noon today, there are 171 patients under investigation admitted in various health facilities in the country. Additionally, a total of 350 patients have already been discharged or facilitated for The decrease in our admitted patients under investigation reflects the department's strengthened surveillance, assessment, and management interventions for COVID-19 health event. Although we see a decreasing trend, the department will not be complacent and will be more vigilant as we brace for the possibility of local transmission in our country, our Health Secretary said. At present, 453 patients under investigations have tested negative for the 2019 novel coronavirus, and there are only 22 cases with pending test results. The remaining patients yet to submit specimens for testing. We cannot underscore more the importance of regular hand washing and observance of cough etiquette to prevent the spread of the COVID-19. I urge all our kababayans to continuously cooperate with the Department of Health to keep the risk of this new disease at bay. Together, we can eliminate the threat of COVID-19, our Health Secretary Francisco T. Duque III have added. Our updates on repatriates: all 49 repatriates at the New Clark City Quarantine Facility show no signs or symptoms of respiratory illness. Repatriates are monitored twice a day to ensure that they are well taken care of. The health and well-being of our repatriates is of utmost importance to President Rodrigo Roa Duterte and our department. We are providing our kababayans with appropriate health services and daily physical and psychosocial activities to keep them comfortable during the 14-day quarantine process. Updates on contact tracing. As of February 17, the Epidemiology Bureau reported that of the 280 interviewed contacts of the first and second cases of COVID-19, 221 have completed the required home quarantine procedures, while 14 are still on home quarantine. The remaining 45 contacts were admitted as patients under investigation, of which 35 have already been discharged, 2 are still currently admitted, 6 are under strict monitoring, and 6 are already outside of the country. On the third confirmed case, a total of 255 out of the 740 contacts were traced, including co-passengers and individual contacts from hotels and hospitals. Currently, 172 have been interviewed. Of this, 155 have completed their home quarantine. Of the 17 symptomatic contacts admitted as patients under investigation, 15 have already been discharged and 2 are now out of the country. We are working with the PNP, CIDG, and concerned local government units to expedite our contact tracing for the third confirmed case. The department is keen on ensuring that all those who might have been in contact with this case may be immediately assessed and facilitated, the health chief concluded.
Okay, thank you very much, ASEC Rosette Vergere. And now we'll be entertaining questions. Trish?
ASEC, I'm not sure if we have enough information about this, but US has already started their plans of repatriating repatriating people from the this is MV Diamond Princess. And does the interagency task force, there already talks about it, of aligning Filipinos in that cruise ship?
Yes, actually, the Interagency Task Force for Emerging Infectious Diseases, chaired by the Department of Health, has already discussed, already have plans for this repatriation. But currently, we are still on that discussion and planning stage, so we will be providing information once everything is finalized.
But so far, do you have any target or time frame as to when you will repatriate the Filipinos inside that cruise ship?
Oh well, the Japan Embassy and even the cruise ship, the MV Diamond Princess has been saying that the quarantine period for this, the passengers of the cruise ships as well as the crew members is already forthcoming. So they are targeting and they are requesting that if we can already do the repatriation once quarantine period is over. So as I've said, we are still discussing, pinag-usapan pa po lahat. At kapag final na po yung mga plano natin, bibigyan na po namin kayo ng informasyon.
Christine Sandy of ABS-CBN Online. Ma'am, you mentioned yung DOH Deputy Bureau is working with PNP for the contact tracing for the third patient. For the first and second ba, habulin pa ba natin yung mga hindi pa na-interview?
Sinusubukan pa rin natin, ma'am, no? Katulad nung huli nating sinabi, na ito pong mga contacts natin na nakalista, no? Marami po tayo, nagkaroon tayo ng erroneous at saka mga incomplete na detalye, hindi natin nakuha maigi, no? At hindi ho natin sila makontak ng maayos. Kaya ho tayo humingi ng tulong sa ating PNP CIDG, also verifying details, no, from other national agencies para masubukan pa rin as much as possible na makita pa rin yung contacts for this first and second, hindi lang po dun sa third case.
Pero eventually ma'am, wala naman kasi nag-positive dun sa iba.
Wala po, oo. And actually all those...
Pababayaan na lang pag hindi talaga...
Hindi naman pababayaan. We still like to know and get feedback or updates on what has happened to these contacts. But, you know, hindi naman natin sinasabi na swerte, pero maganda rin na lumalabas na out of all of those contacts that had been traced and were placed under self-monitored quarantine, or those hospitalized, lahat naman po, halos lahat ay nagka-turn out na nagre-resolve na, no? At natatapos na rin nila yung home quarantine nila.
Okay po.
So we just like to clarify, lahat po ba ng mga nandun sa loob ng cruise ship are considered PUI since nasa confined space sila? And also, have you already, do you have any word from the Interagency Task Force kung meron na pong kinoconsider na quarantine facility for those who will be repatriated from the cruise ship po?
Yes, ma'am. Actually, dun po sa confined space na yun, we are considering that all of these people would be considered for quarantine once they come back, ang ating mga repatriates. Kung ano po yung kinoconsider ngayon ng Interagency Task Force as a facility for them to be quarantined, pag-uusapan pa po. Ngayong hapon po, may technical working group meeting regarding this matter, and tomorrow there would be this high-level Interagency Task Force meeting to have this discussion and hopefully magkakaroon tayo ng final agreement by tomorrow.
Ma'am, follow-up lang din po. Do you have any idea kung sila po ba ay na-test na, nakuha na ng sample, and are there any results po kung sila po ba ay positive of any respiratory infection po?
They are being regularly tested, no? That's part of their monitoring. Pero yung bago sila pumunta, bago mag-disembark or pumunta or ma-repatriate sila, meron po silang protocol din, no, ng pagtetest. So malalaman po natin yan in the coming days once we have already finalized our agreements with them.
Ilan po sila?
We have a 500 plus number of crew plus passengers in that MV Diamond Princess. Talking about Filipinos only.
Alright.
Ma'am, good afternoon po. John Eric Mendoza po from Manila Times. Now that ma'am na nag-decrease na po yung mga cases ng PUI and marami na po yung discharge, is it safe to say na parang on the way na po itong virus sa bansa natin?
We cannot say that, no? Kasi katulad nga ng alam natin, or actually hindi natin alam natin lahat, marami pang gaps, no, doon sa impormasyon na meron tayo ukol dito sa COVID-19. Hindi pa natin nabibigyan ng definite answers, wala pa tayong enough na ebidensya para masabi natin yung mga scientific or, you know, epidemiology, yung pinagmumulan ng sakit, gaano katagal, and all. So kahit nakikita natin ngayon na medyo bumababa ang ating mga kaso, hindi po tayo dapat maging complacent. We should always be ready for that possibility na maaring magkaroon tayo ng local transmission in the future. Sana hindi, pero nandun yung posibilidad. So hindi natin masasabi ngayon na okay na tayo and where the trend is going down at wala na tayong magagawin.
One last question, dun po sa cruise ship, parang mga 300, around 300 na po yung test positive. So, wala pa po bang report yung WHO na parang airborne na po yung disease? Kasi ito na quarantine naman po sila lahat at po kakalat po dun sa buong cruise ship na ito.
Ngayon, wala pa rin enough evidence to say na meron tayong airborne transmission para sa COVID-19. Ang sinasabi pa rin, it is spread through direct contact at saka droplet infection. Ngayon, when it comes to the sheet, kung bakit kumalat siya, hindi mo natin alam yung pinaka-eksaktong circumstances nila within that sheet kung paano kumalat. Pero alam natin, everybody is in a confined space at merong close contact, of course. So, doon natin makikita kung bakit parang mas mabilis ang pagtaas ng mga number ng mga positive cases. But no WHO statement yet. Wala pong ebidensya pa na nagsasabi na airborne na po ang transmission ng ating COVID-19.
Ma'am, nung meeting ng Friday ng IATF, na-discuss ba kung ano yung mga guidelines para masabi natin na dapat mag-impose ng travel ban on a particular country? Ano yung metrics na ipa-follow natin?
We have initially discussed this during the IATF meeting last Friday where DOH presented recommendation kung saan magkakaroon tayo ng basihan kung para masabi natin how we restrict a country or travelers coming from a country going to our country because of this situation. Iyon ay rekomendasyon, iyon ay palalawigin pa at pag-uusapan pa kasi dun sa tool na binigay namin, ang ibang ahensya ay kailangan magbigay din ng inputs nila para malagay natin what is for tourism, what is for labor, and then what is for health. So we have to make it as comprehensive as possible. Hindi pwedeng health lang ang pagbabasihan natin. So nandun tayo ngayon sa pag-uusap na yon, pinag-aaralan. Bukas, meron po tayo uling interagency task force meeting at doon siguro pag-uusapan po namin ulit.
Yung Singapore and Thailand, given na may local transmissions na COVID sa countries na ito, kina-consider ba natin or is there a study kung may possibility of a travel ban? And yung Hong Kong and Macau, most likely kailan po malilift yung travel ban?
Wala pa akong may sasagot sa iyo, no? At hindi ko rin masasagot sa iyo kung ano yung mga countries na pinag-iisipan nga natin ngayon para may isama dito sa ating pag-aaral kung kasali pa sila sa ban or hindi. One thing for sure, alam naman natin lahat, ang ating restriction for passengers or travelers would be only including China, di ba? Including Hong Kong and Macau, and yung Taiwan na lift yung ban. But for Singapore and Thailand, because they have local transmission, hindi lang po sila ang mga bansa na may local transmission, marami pa pong iba. So wala pa po tayo sa ganung usapan with our interagency task force. We will be providing you with information in the coming days. But definitely, magkakaroon po tayo ng basihan kung bakit tayo nag-i-include or nag-i-exclude ng isang bansa or ng mga travelers coming from a country to our country.
Ma'am, yung sa CNET po ng Diamond Princess, i-clarify ko lang po. So pagbalik po nila dito sa Pilipinas, ika-quarantine po ba sila ulit?
Isa yun sa pinag-uusapan, ma'am. Dapat natin intindihin din yung mode ng kung paano sila nahahawa within that sheet. No? Hindi naman po lahat sabay-sabay na isang first day ay sabay-sabay silang na-expose. Sliding po yan lahat. Merong ibang tao dyan, dun sa 9th day nila ng pagkakatigil dun sa kanilang lugar or kwarto, nun sila na-expose, yung iba sa 8th day and all. So, we are considering everything so that we can properly manage po pagdating nila dito kung ano po ang dapat para naman ma-minimize natin din yung risk natin na makakapag-transmit sila sa iba kung sakasakali.
Next question.
Particular lang po ako dito sa crew. Ano po yung mga trabaho po nito? Kasi kung may balita pong lumabas na pinagsaserve pa raw po yung mga crew, mag-serve pa rin po sila.
I cannot give you that information, sir. Maybe mas better siguro kung sa DFA because they are in direct coordination with the cruise ship owner and the Embassy of Japan. Sila po makakapagbigay ng ganyan informasyon.
Okay. Bob Moraes, TV5, ABS-CBN, News Apples. Bob Moraes.
Hi ma'am, balikan ko lang po yung data na present ko last Friday dun sa third PUI mortality. Just curious kung dumaan po ba yun sa dalawang test kasi yung previous na PUI mortalities parang may isa sa kanila na on the first testing, negative siya sa COVID, pero nung second test siya na nag-positive siya, doon palang na-confirm na COVID siya.
Yes, sir. Yun pong babalik ako sa second po na question. Yung third case natin ng COVID-19, yun yung sinasabi mo na nag-positive siya, nag-negative siya, tapos tsaka siya nag-positive. Hindi po yun mortality, ha? Yung mortality natin for COVID-19 exhibited or presented with positive results. Ngayon, ito pong patient under investigation natin, na latest na mortality, yun pong sa Region 1, tested negative. In our guidelines, which we have issued out in order for us to streamline din, ang ginawa po namin, basta ikaw, patient under investigation, you test negative once, you are asymptomatic for 48 hours, you are already advised na pwede ka na umuwi, no? And tapos na yung quarantine mo and you're cleared. Okay, so ito pong namatay natin, he was tested negative for COVID-19, no? COVID-19. Bukod doon, meron siyang ibang mga comorbidities, kaya siya ay namatay, and not because of COVID-19.
And ma'am, last, kumusta lang po yung steps or yung talks ng DOH? Kasi parang ang plan po is aside from RITM, magkaroon din ng ibang facilities para mas mabilis pong makakonfirm yung mga DOH.
Yes, sir. Actually, nung nakita na natin yung surge of in the number of specimens being provided or sent to RITM, the Secretary has instructed that we activate now our sub-national laboratories. So there are 5 sub-national laboratories na makakatulong sa RITM sa pagtetest nitong ating mga specimens na to, and for us to have faster results for laboratories. Strategic po ang areas nito. Meron tayo sa Davao, meron tayo sa Cebu, meron po tayo sa northern part of Luzon, at meron po tayong malalaking hospital dito sa Metro Manila. So hopefully once they are activated, we're just completing yung requirements nila. Sa ngayon, nagbigay tayo ng mga logistics, tapos po ay humingi rin tayo ng tulong, of course, with our partners para mabuo na yung mga pangangailangan nila. Hopefully, in the next 2 weeks, we'll be able to have them functional at makapag-umpisa na tayo ng testing with them.
Okay, next, TV5, ABS-CBN, then Ms. Atkins. Sir.
Ma'am, ask lang po kung may update po about sa polio. Kasi lumalabas din po na positive yung river doon sa Cebu.
Yes, sir. As of now, we have already issued out in our press release last Saturday that there is the 17th case of polio here in our country. The case is a 1-year-old male from Region 3 from Nueva Ecija in Cabanatuan. The boy exhibited this onset of paralysis last January 15. They sought consult on January 22, a week after, and was found to have fever and yung tinatawag natin na panghihina ng mga lower extremities. Meron ding parang muscle pain na sinasabi. Nung tinest siya, siya ay positibo sa vaccine-derived poliovirus 2. At ang kanyang history, he only received 1 dose of polio vaccine last February of 2019. Hindi siya na-admit, kumonsulta lang sila dun sa community health worker nila, at ang pamilya ay medyo resistant sila sa pagdala sa bata dun sa ospital because they have, meron silang mga paniniwala sa kultura at gusto nilang mapagamot sa ibang doktor, or local leader. Okay, so ngayon ang ginawa natin, nung nalaman natin ito, nagkaroon tayo ng maigting na pagsusuri. We want to have strengthened surveillance, and of course, yung ating immunization ay dapat pag-iigtingin din dito sa mga areas na to. Now, what we had in Cebu was a positive environmental sample. Environmental sample doon sa isa sa kinukuha na natin ng sample doon sa Cebu, at nagpositibo rin itong sample na ito last week din, and we also have included Cebu or Region 7 doon sa part ng nagkakaroon tayo ngayon ng strengthened surveillance and vaccination, catch-up vaccination, para lang ma-address natin itong issue na ito. We're strictly monitoring, and after 2 weeks maybe we can provide you with additional information.
Ma'am, should we panic? 17 days or not?
No, we're not supposed to panic as long as we are doing what DOH is saying. Katulad nitong sa polio, alam natin lahat kung paano natin nakukuha ang polio. So dapat ang mga pamilya, ang mga nag-aalaga sa bata, papakunahan nyo ang inyong mga anak. kapag kayo ay nagkakaroon ng parang suspicion, no, kung bakit ganito ang ina-exhibit ng mga bata, galing agad sa pinakamalapit na health facility. Pangatlo, maging malinis sa kapaligiran. Kasi alam natin, yung polio nakukuha natin through orophytal route. No? So kung sakasakaling walang mga maayos na palikuran, doon po nag-uumpisa ang sakit na ito. So kung magagawa lang po natin ito lahat, no, mga measures na ito na binibigay naman na libre ng gobyerno, there's no need to panic regarding this matter.
Okay, we have last 3 questions. ABS-CBN, Ms. Abels, and then Ma'am Sheila.
Natanong na lahat. Ma'am, nakatulong ba ng malaki yung travel ban sa pagbaba ng kaso natin sa COVID?
Hindi natin masasabi, sir, no? Kasi ang travel ban, no, actually it's a restriction for travelers coming from China. Hindi mo natin masabi sa ngayon, no? Pinag-aaralan yan mabuti kasi may mga numero tayong titignan. Kung titignan po natin sa layman, no, pag pinag-uusapan natin, maari, no, at maaaring hindi rin. Kasi pag tinignan mo natin yung scientific studies ngayon, WHO has a published study na sinasabi na ang restriction ng travelers or travel bans hindi siya masyadong effective para makontinue ang isang sakit. Sinasabi dun sa study na yun na maari na pwede mo lang ma-delay yung eventual na spread ng sakit sa bansa mo, pero ang magandang may dudulot ay mabibigyan ka ng panahon para mas makapag-prepare pa ang iyong bansa. So sa ngayon, hindi mo namin masasabi kung yung decision natin na mag-restrict ng travelers coming from affected areas ay nakatulong, nakapagpababa ng kaso. Malalaman po natin yan after so many months that we can study all of the numbers that we have right now.
Last 2 questions, Ma'am Abels, and then Ma'am Sheila.
Okay. Thank you. Ma'am, may mga reports po na lumalabas na may risk din daw yung mga buffet at hotpots sa COVID-19 dahil nga siguro dahil may close contact yung mga tao sa mga buffet at saka hotpots. Magkipag-ugnayan din po ba kayo sa F&B, food and beverage industry?
Kami po ay nakikipag-ugnayan actually sa lahat ng sektor. Sa lahat ng sektor sa ngayon, no? Sa lahat po ng sektor, nakikipag-ugnayan po kami sa ngayon. Financial sector, even the food and beverage. We just had our meeting last week, I think, with the hotel owners together with the Department of Tourism. So, ang gusto lang po namin ipahatid sa inyong lahat. Kung ano man po ang ating mga binibigay na advisory para sa pag-iwas, these are general precautions. Hindi mo natin kailangan tukuyin na pag ikaw ay nag-buffet, pag ikaw ay nag-shabu-shabu ba, ikaw ay makakakuha ng sakit. General precautions means kapag maraming tao, syempre gusto natin umiwas, no? At hindi naman po sinasabi na minamandato, huwag kayong pumunta sa mga ganyan. Hindi po natin sinasabi yan sa ngayon. Ang sinasabi lang natin, we practice our universal precautions. Kung sakaling hindi maiwasan, kailangan umattend ng mga ganito, we know what to do. Cup etiquette, magugas maigi ng kamay, and pag may naramdaman po tayo, tumawag agad sa aming hotlines. We cannot confirm, we cannot say, tama po yan, na kapag yung mga sa buffet and shabu-shabu, kasi hanggang ngayon naman po, wala pang direct evidence kung saan nag-originate talaga. Diyan po ba dun sa mga exotic animals ng China, hindi pa po yan nasasagot. O talaga bang nanggaling na from an animal going to a human and then human to human. Marami pa hong hindi nasasagot ngayon ng siyensya at aabangan pa ho natin bago tayo magkaroon ng definite answers to that.
Last question, Ma'am Sheila.
Ma'am, regarding po sa polio, walang plan to expand yung vaccination sa lahat ng regions since nagkaroon ng rise nila?
Nag-uusap pa kami, ma'am, no? Actually, nasa back ho yan ng mind namin. Of course, we would want that. But also, inaantay ho namin yung rekomendasyon ng ating technical advisory group ng WHO kung saan sila po yung nagbibigay sa amin ng direksyon kung anong gagawin natin kasunod base sa sitwasyon natin ngayon. So ngayon ho, inaantay lang ho natin yung rekomendasyon galing sa World Health Organization kung ano na ho yung susunod natin na step since we have identified again another case in Region 3. But while we are waiting for that decision or recommendation from WHO, ang kanilang inirekomenda na start doing the strengthening of surveillance. So nagre-retrospective review po kami ng mga records, pumunta na doon sa areas, nag-iimbestiga, and also we'd like to see and catch up the vaccination of our children in that area.
Kung yung presence ng virus sa Cebu River, indication yun ng yung likelihood or possibility na magkaroon ng infection sa area ng case?
Oh well, pag nandun na ho siya dun sa daluyan natin ng tubig, nandun po yung posibilidad. But we are not saying na pwede na agad-agad, no? Pero yung posibilidad, the risk is there, of course.
Okay, I think ASEC, 2 last questions na lang. May humabot pa. Ma'am, and then Ma'am. 2 single questions, please.
Ma'am, follow up dun sa buffet. May health auditor kasi na interview kami and he was saying na tama po ba, mas mataas yung risk, kunwari kung in case na droplet na yung transmission, pag buffet, like magkaharap daw kumakain, so there's saliva, parang yun ang kanyang hypothesis, kaya mas maraming nagkasakit dun sa cruise as compared sa mga airlines na hindi naman ganun yung environment. May ganun po bang mga studies in terms of yung transmission ng mga respiratory na droplets?
Yes, ma'am. Pag tinawag natin na droplet, yan po yung mga short distance lang po ang tinatravel. Halimbawa, sa nagsalita ka, umubo ka, kaway dumura, 3 feet po ay yung virus ay pwede mong maipasa. No? Yan yung droplet infection. Pero ayoko pong mag-zero in doon sa sinasabi niyo pag nag-buffet ka o kaya kapag ikaw ay nag-shabu-shabu. Kasi tanggalin po natin tong impormasyon na to sa utak natin because we are going to scare people away. And our businesses would suffer because of this misinformation. Ang sinasabi lang mo natin sa ngayon, ang meron pa lang tayong ebidensya na sa ngayon, ang ating working na mode of transmission is through direct contact and through droplet infection. If it's going to affect, like when you eat in front of your friends, your neighbors, nandun po yun dun sa general context, kaya tayo nag-universal precautions. Pero wag po natin idawit na dapat at gamitin, no? Kasi it's going to spread again, news that will scare people, yun tungkol sa buffet and, anywhere you can get it actually, kahit saan, pwede mo makuha, kahit sa pag-uusap natin, yan, pwede natin makuha, no? Ang sinasabi lang natin, iwasan natin at tayo ay mag-practice ng precautions na sinasabi natin.
Last question, Ms. Irene.
Would DOH or the Interagency Task Force consider yung protocol like from those who came from Wuhan? Since meron pong positive case nga na Filipino sa cruise ship, would you follow that protocol or meron pong bagong pinag-uusapan ngayon ng Interagency Task Force to at least have the case management of those who will be coming from the cruise ship?
Actually, kung protocols pang pag-usapan ng guidelines, we have basic principles that we adhere to when we do our protocols. So whatever principles that we adhere to when we implemented these guidelines in the New Clark City, those coming from Wuhan, it will apply the same, similar, coming from this cruise ship from Japan. Pero syempre, dahil po dun sa sitwasyon na mas madami sila, contained yung kanilang space, and the other things that has to be considered, meron po tayo mga siguro may dadagdag na additional protocol or guidelines for us to be able to appropriately manage to mga galing sa cruise ship na uwi dito sa Pilipinas.
Okay, thank you very much. So that concludes our daily